A very warm good morning to all. It is my pleasure to welcome you all to the Rise for Healthy Aging conference hosted by Longevity India. I hope you are all as excited as I am, and we can hope that we'll be having enriching scientific discussions at this platform. So, without any further delays, I would like to introduce our chair and co chair for the first session, which is on lifestyle medicine and longevity. So, Dr. Alexander Thomas will be chairing the session along with Shaina Parikh as the co chair. Dr. Alexander is a founder and patron of the Association of Healthcare Providers India. With over 4 decades of experience as a healthcare leader, he has played a pivotal role in driving significant healthcare policy reforms. Shaina is a medical school development officer at IISc, and she's a specialist scientist now working in Siddharth Jhunjhunwala's lab in the Department of Bioengineering, ISc. So I welcome both of you to commence our session.
Thank you, and again, a warm welcome to all of you on behalf of the organizers, on behalf of my co chair, and the others. So, it's an honor to chair this session. And here we are trying to focus on the growing importance of lifestyle medicine and longevity. As we go through this very complex area of aging, I think one of the most compelling realizations in medical science today is that our lifestyle choices, that's what we decide and what we follow, are among the strongest determinants of both lifespan and also health span. Advances in longevity research confirm that while genetics do play a role, modifiable lifestyle factors, nutrition, physical activity, sleep, stress management, and social connections, they have the most profound impact on how we age. Lifestyle medicine, I'm sure all of you sitting here are aware that it's no longer just an alternative or supplementary approach to healthcare. It is the foundational strategy for extending healthy years of life and preventing premature aging. Chronic diseases, as we heard in the sessions before this, as cardiovascular conditions, diabetes, neurodegenerative disorders, are among the biggest threats to longevity. Yet, I think the evidence to all of us is very clear. These conditions are largely preventable and, in many cases, reversible through lifestyle interventions. In fact, many of my colleagues are speaking today. We were at the National Health Conclave at CMC Vellore in October 2024, where we emphasized now if you look at from the healthcare perspective, from the healthcare providers, it's more of a focus on curative healthcare. So we are now trying to look at how we can change that to become a preventive model, and we are now very sure that this can dramatically increase longevity and reduce the burden of NCDs. And as was said earlier, some of the key takeaways are whole food plant-based nutrition, regular physical activity, quality sleep, and stress management. These principles are also, we have also brought out a book, and I mean colleagues Shaina, Sam, Hub brought out a book called Lifestyle as Medicine, and these principles are also extensively detailed in this book. This book is incidentally available as a free download um, um, on Amazon, and this was actually it was released sometime in August last year, doing phenomenally well. We have already, I think, published about 10,000 copies. A lot of the free downloads are being used, and we are very happy with the progress. So, beyond lifestyle, individual health, lifestyle medicine has profound implications. As we said, that a healthier population leads to more productive workforce, and preventive healthcare through lifestyle medicine is cost effective, significantly lowering healthcare expenses and easing pressure on medical infrastructure. So, this session, we're looking forward to go deeper into the key lifestyle factors that influence longevity, from nutrition and exercise to sleep and stress management. And as we listen to our distinguished speakers from all over the country, we need to think not only about the science behind longevity, but also how we can translate this knowledge into actionable strategies for individuals, communities, and healthcare systems. With that, it's my pleasure to introduce our keynote speaker, Dr. Samuel Hansdak, professor and head of the Department of Lifestyle Medicine from CMC Vellore, who will elaborate on lifestyle medicine, a holistic blueprint for longevity and health span extension. Over to you, sir.
want to thank Dr. Alex for this wonderful introduction, and really want to thank Shaina for really organizing all of it and bringing us together. Uh, Today, I'll be talking about lifestyle medicine blueprint for longevity. We have been talking about lifestyle. Longevity has just come up, and we are trying to see how we integrate both of them together. Esteemed dignitaries, respected colleagues, and my dear friends, I bring greetings from CMC Vellore. For the next 10 minutes, I'll be speaking on lifestyle, medicine, a blueprint for longevity. Conscious about time, we'll try to move as fast as possible. So the outline of my presentation is as follow. I'll define lifestyle medicine and its domain. Most of us are familiar with that. And I will highlight the role of various things like environment, social connectedness, stress, and spirituality in longevity. If we begin with the epidemiology, the top killers due to NCDs are heart disease, cancer, and respiratory disease. The total number of deaths due to COVID 19 over 3 years were about 7 million. And I just want you to look at that figure. There are 17 million deaths due to heart disease every year. For COVID, the whole world was shut down. Neither KFC nor McDonald's was shut down because of heart disease, which kills 17 every year. Quite a paradox. 1948, we are all familiar with the definitions of WHO. I'll use this concept to look into four paradigm shifts. I feel these are fundamental to our understanding about lifestyle medicine. We'll go through each one of them. There's a paradigm shift from medical care to healthcare. We'll keep hearing it all the time. We are looking after organ-based approach to a whole-based approach, from symptom-based treatment to root cause and treating disease to promote well-being. So, if you look at the first paradigm, we are talking about change from the whole word medical, which almost all the medical colleges are named, to something health. I was very intrigued to find, and I worked here for about 6 years. It's called BP Corral instead of health sciences. The word health itself makes your mind think from medical to health, and that is one of the first paradigm shift that we need to move. When I came to CMC Vellore, it was interesting to note some of the words used. For pediatrics, they use the word child health, psychiatry is mental health, and preventive medical, social medicine is community health. That one word speaks it all between us being a little, I wouldn't want to use reductionist, I will use the word specialist, from specialist perspective to a holistic perspective. The second paradigm shift is from organ based to whole person based, from a super specialty to family medicine. I don't want us to stop going for cardiology, but here's what I would use. We should treat the patients with a super specialist precisions, but in a holistic manner. If you can get that paradigm, that means we are not saying that you don't go into details of learning medicine, but keep that holistic. Robinson says very good, don't come so close to the tree that you lose sight of the forest. And that is so very important. The American College of Lifestyle Medicine has come with 6 pillars. We know that. It's very interesting to see the American Heart Associations came up with this Life Simple 7 in 2010, which was upgraded to Life Essentials 8 in 2022, incorporating sleep. So now most of the mainline streams have started acknowledging and accepting it. And most important is, how do you manage an equilibrium between all these domains? And imagine, this concept has been existing in ancient culture of the Chinese, the Greeks, and Ayurveda, where you talk about a balance across all these domains. Next is paradigm shift 3, where we talk about symptom to root cause. Now it's very interesting. I usually ask the questions, how do you treat malaria? What does a patient with malaria presents with fever? So I said, why don't you give them paracetamol? Oh, but then the fever will come back again. So give them paracetamol after 4 hours. So treatment of malaria is paracetamol 4 hourly for lifelong. Acceptable? Absolutely absurd. But what are we doing with all other disease? Every other disease we treat them for lifelong. Something to think about. Paradigm shift 4 is where we move from treatment to remission or reversal. We are talking about cure. Can we cure diabetes? Of course, no. Can we treat diabetes? Yes. Can we ask the question again? Can you cure diabetes? Very reluctantly, we had to take the help of our surgeon colleagues to teach us how to remit diabetes. And the bariatric surgeries and these other studies which showed diabetes remission. And to look at those figures, 83%, 72%. And so lifestyle medicine also began with the look ahead trial, the direct trial, and the retune trials, which shown diabetes remission on these falling percentages. So can we cure diabetes? If you look into the American Diabetic Association vision statement, when they they were talking about eradicating diabetes, right? We also started with National Malaria Eradication Program. Then we kind of switched gears and made it control program. So finally, the American Diabetic Association has accepted in 2020 to use the term diabetes remissions, and they've given the classifications for that. Somewhere in 1990, Dr. Dean Ornish, many of you are familiar with, brought on this very historical concept that a process like atherosclerosis can be reversible. His study published there 1990 and in 1998 in both Lancet and JAMA. Yet you ask a cardiologist, they will look at you with the weird expressions. Really? Who did that? So here I'm just going to show you some of the landmark studies. Since we are short of time, this is just to give you a sense that lifestyle is not about some people's wishful thinking, but something that is well based on science. And these are the compilations of various studies that has been done right from 1938 onwards. I'll just few of them. I'm just giving you the date 1948 when the WHO definition was kept. We all heard about Framingham study. For the first time, we came to know the risk factors for heart disease, and that was listed down. And this whole group of people in Boston and Framingham, we first time came to know the risk factors for heart disease. In 1970, the Adventist Health Study, they had two cohorts, and here we found the associations of various lifestyle principles. I'm not going to the details. The nutrition, the exercise, the social connectedness, the spirituality showed that people, one, lived longer, had fewer diseases, and that people were able to connect with each other. Harvard Medical School started their cohort first with the nurses and then later on with the physicians, called nurses health study and the physician health studies. Look at those numbers and look at the period of follow-up. All these were talking about the same thing, the associations of most of our non-communicable disease with diet, various aspects of diet. Heart disease decrease trans fats and bread reduces your heart, increasing fiber and nuts reduces your heart disease. Breast cancer was one of the major studies among the nurses, which showed strong correlation of obesity, sedentary lifestyle, alcohol, and hormone therapy. Look at hormones. The environment also contributes to our health and longevity. Numerous studies has been looked into the effect of pollution in the air, water, food. We have association of smoking and alcohol has always been well proven. And the new in the field is climate change and screen exposure. Somebody said within the first 1 to 2 hours of your day, you're exposed to more than 5,000 chemicals, from your brush to your face wash to your shampoo to your soaps. Everything has thing. When you look at the social, we have social factors, social relationship, social support, and social engagement. Just look at it. Loneliness is more dangerous than obesity and as damaging to health as smoking 15 cigarettes a day. And money and fame, in this study, money and fame has nothing to do with happiness. So, okay. And on stress, our Nobel laureate, Dr. Elizabeth Blackburn, talked about how with increasing stress, there's decrease in the telomere length, which reduces your longevity. And if you look at spirituality, in both the two blow zones, Okinawa, they talk about Maui, which is talking about meeting for a common purpose. One of the major reasons for their longevity are social connectedness and having a purpose in life. And the Seventh-day Adventists at Loma Linda, they drive the purpose and meaning on a peculiar observance on Sabbath. They stop all work, connect with people, look upon for the transcendence. So, what is health? Health is a balance between all these domains. Disease is a disequilibrium. And if you look at the disease model, the largest component is lifestyle. And so, what is healing? Healing is really getting back that equilibrium. And so, here is what I want to say: this is not an easy thing, it's complex. You have to address self issues, you have to address environmental issues, both physical and social. Who has a time? And finally, the transcendence. Behavioral change is always complex. And look at the relapse rate. When you give them simple educations, hardly at the end of 1 year, you hardly have people following it. You have to add on multiple components, not going into the details of it. I will finish with transcendence. What is transcendence? If we believe there's someone higher than us who gives us meaning and purpose in life, we may have some inner peace, some purpose in life. We connect with people as co workers to move towards bringing some meaning in life. And the values and morality is what determines the choices that you make. And if we are able to do that, we are able to bring health and happiness among people. So, thank you for your patience, audience.